Community Hospital is located in Grand Junction, Colorado, and we are on the western slope of Colorado, and we have about 150,000 people that we consider in our service area, and that does bleed over into eastern Utah. As a small hospital, one of our challenges is low volumes in certain areas. So how do we make sure we're proficient for different service lines that we don't do a lot of? You know, we're hoping to be able to deliver as much care at the highest quality, the lowest cost locally. We know there are certain things we're not going to provide as a community hospital, and we want to make sure we have a partner that can provide those services, whether it's transplant services or advanced cardiac care or different oncology services. You know, some of the things we're talking about with the University of Utah is different scopes of work. The first one we're doing at Community Hospital is telemedicine. We will be directly connected to the University of Utah so our physicians and our staff can have consults, so our patients that are here will be able to have the expertise of the University of Utah without leaving home. For us being in Colorado and having a partner in Utah, it brings special challenges. We have state lines, we have state Medicaid that we have to deal with, we have insurance companies we have to deal with to make sure that patients can cross state lines, etc. And then as far as the telemedicine, you know, one of our challenges is those physicians need to be licensed in the state of Colorado. So we have to go through the process of getting them licensed in Colorado, and then we have to get them credentialed on our medical staff. And not that these are insurmountable challenges, but it's just another step that we have to do dealing with a partner that's across the state line. I think one of the things we're trying to accomplish with this affiliation is a seamless transfer, whether it be the patient's ease of using either Community Hospital or the University of Utah data. We want to make sure that when a patient goes up to Salt Lake and they come back, that their physician here knows what's going on, has the information necessary to continue care. And so I think this affiliation is going to strengthen that flow of information, both from here to Utah and also from Utah back here, because eventually those folks are going to come home, and we want to make sure that their local family practice doc knows what's going on so we can continue taking care of them in the most efficient way. What we've heard, because we spent a lot of time with the physicians and the medical staff before we made this decision, and what we've heard almost to the person is that they already prefer working with the University of Utah, that the flow of information is better than working on the Front Range. And so we really got a lot of support from the medical staff on moving this way. Obviously, from their point of view, they want to make sure they get their patients back, and they want to make sure they get the care they need, but they want to get their patients back and into their practice. And so I think we've found a partner that's committed to doing that, helping us advance and become a successful organization, and then being there to support us if we need help, and not the other way around. I think where the University of Utah is going to benefit from this relationship is potentially expanding their market and having a bigger presence on the western slope of Colorado. And so if we can form a partnership that's successful, I can see a larger number of our residents choosing to go to Utah instead of going to Denver. And I think that's where the University of Utah has the potential to gain from this relationship. We are never going to be an academic medical center, level 1 trauma center. We're never going to do transplants. We need a partner that does, and I think that's where the University of Utah is going to benefit, is we can help expand their market for those services. We're really trying to strike a balance of what can be done locally and what needs to be provided by our partner. And so I think with the University of Utah, while it's one of our opportunities, it's one of our challenges too. We also don't want to see all of our patients leaving and just going to Salt Lake. We need to keep those folks here. And so I think that's going to be a challenge as we develop this partnership, is how we find that balance of what's good for our patients, what's good for Community Hospital, and what's good for the University of Utah. If you fast forward, what we're hoping in the next couple years is that we expand the services that are provided local, that are expanded in a way that we're providing the best service we can, but then making sure we have that partner where if there are services that are not appropriate for Community Hospital and for our community, that we get them to the right place.